What if I told you that you can relieve your sciatica, improve the pain, and decompress the nerves in your spine in just 3 days? Would you believe me? This is what I bring you today. A decompression position that will help you open the conjunction hole, exactly the place where the nerves of your spine pass through, and significantly improve your sciatica. A study that was published in April of 2025 and shows us how. By applying that posture through magnetic resonance imaging, it is shown that this space increases, the pressure decreases, and the symptoms improve. To carry out the technique, you will need 2 items. A cushion of a certain thickness. The thicker it is, the more intensity we can give to the technique. And a sofa, a bed, or even an examination table, especially on the outer edge, because this will allow us to place one leg outside and give more opening, more leverage to the technique. I want you to pay special attention to all the instructions I give you and follow them one by one, because all the parameters are extremely important for the technique to be completely effective. I'll do it on both the right and left sides. Also for the left side, so you can learn depending on which side is yours. How should you do it in your case? The leg that has discomfort or sciatic pain in the back is always the one you place on top. So let's start with the first example if you have sciatica in your right leg. The first thing is to lie on your side. Take that cushion and fold it a little, just like I'm showing you. Make sure it's bulky so you can lie on your side and rest your lumbar spine on it. Get comfortable. I'll adjust for a better camera view. Rest your head on your hand. From here, we'll start with the position of the legs. Remember, this position is for when we have sciatica in the right leg. I want you to move your left leg forward until your knee is bent at about 90 degrees and a flexion of approximately of the hip at about 90 degrees. Next, I want you to move your opposite leg out to the side. Maybe you can't see it there, but my foot isn't resting on anything at all. Leg completely stretched, leg slightly out to the side, and let it drop with gravity as much as possible. If you fall backward, use your opposite arm in front to counterbalance. From this position, we're already creating a certain feeling of openness along the entire lateral edge of my spine. The next step would be to introduce a trunk rotation. What I'm going to do is lift my torso a little, slide my left arm underneath, leave it at the edge of the bed or table, and hug the opposite side, resting it on its side so my head can rest on it. The requirement for the arms is that there should be a 90-degree abduction, that the arms are raised quite high, and that this arm here is left completely hanging. You have to try to lower your right leg as much as you can, pressing it backward and downward. This way, we ensure a complete opening at the lumbar area. The thicker the cushion, the more lateral flexion and greater exercise intensity. You should feel some tightness in your lower back, especially here at the quadratus lumborum, since that's exactly where we want to direct attention, that there isn't enough pressure. I recommend you change that cushion. I recommend you move that leg further back or lower, and from here, just get comfortable, close your eyes, and hold the position for 20 minutes. Don't worry, because as soon as I finish the technique on the other side, I'm going to show you how you can work with the intensity. If you see that your right leg touches a lot down here on the couch, slide a little more toward the edge so there's less friction. It can touch a little, but you don't have to rest it completely. I don't want the couch to support the weight of your leg. Let's start again with all the parameters. In case you got lost, I want you to take the cushion, fold it in half so it's a bit bulky, place it at your waist level, and lie on your side on top of it. That cushion needs to be between your ribs and pelvis. We position ourselves on our side in a comfortable position, and this little hand can help you keep the position more stable. Legs bent, the sciatic leg is the right one, I move my left leg forward. 90 degrees of hip flexion, 90 degrees of knee flexion, I move my right leg back and down. If you fall, this arm can serve as a counterweight. And next, once we're here, with no discomfort and just tension, we can increase the intensity of this position by adding a rotation at the trunk level. I lift my body a little, bring my left elbow back until it's hanging down. Arms at 90 degrees, as if we had to form a cross with our body. I rest my right hand on the mattress or the couch, let my head drop to relax, and with my right leg. What I'm going to do is pull further back and further down, and I hold the comfortable position. Tightness in the lower back area, depending on how tall or short you are. It's possible that you might touch the ground. I'm just barely touching it, but that's because I'm quite tall. And from here we simply hold. 20 minutes breathing. Emphasizing that your right leg goes further down, okay? And also goes further back to open up your right lower back area as much as possible. Okay, this is the best we can do to the right side, the right leg, if you have sciatica in your right leg. Now let's do the same thing with the left leg, and the instructions will be exactly the same. We're just going to switch sides. Again, we position ourselves right at the edge. The leg you want to treat goes on top, and your back is placed against the edge of the sofa, bed, or table. We fold our pillow so that it has a certain thickness, which helps promote greater lateral flexion. Remember, the thicker the pillow, the more intensity we'll give to the exercise. I lie down completely, my legs are bent, and I place this hand here simply for greater comfort. I move my right leg forward a little, which will have a 90-degree bend here, 90-degree hip flexion, a little more here. I extend my left leg back and down. Be careful not to fall. If someone can assist you, that's ideal. What I do is put this arm in front to create a bit of counterbalance. And once we're here in this position, we have to add the upper rotation at the arm level. I lift my back a little. I slide my right arm underneath until it hangs down. My left hand serves as support, shoulder adduction, as I said, 90 degrees. As if we wanted to form a cross that's not too low, nor too high. Midpoint. From here, I breathe. And I let my leg drop as much as possible, making an extra effort to move that leg back and down. Tightness, where are we going to feel it? Very simple, right here in the lower back area. Here, I notice, for example, again, that my right leg slightly touches at the thigh level. Here with the sofa, I'm going to slide back a little more to reduce that friction and make the exercise much easier, more effective. I set parameters and let my leg drop, which will function, which will make an effort to go back and go down. It's important that you keep that leg as far back and down as possible. During the process of the exercise, we close our eyes, we breathe, and we hold the position. I'll explain it again for the left leg. Let's go back to the example. I sit on my bed, on my couch, on my bed, and then I fold that cushion properly. I lie down on the cushion. Let me check the audio. I lie down on the cushion. My right hand serves as a cushion for my head. Right leg moves forward, left leg goes back and down. If you fall, use this hand to grab onto something for balance. Once here, we bring in the chest. I bend slightly and move my arm behind. 90 degrees of abduction, like a cross of Jesus Christ. My hand rests. It's placed more under the head for support, and I let my leg drop, which has to go as far back and as far down as possible. And I breathe and hold the position for 20 minutes. The thicker this pillow is, the more lateral flexion and the more opening you'll get. The farther and lower that leg is, the greater the intensity, also of the exercise. The left leg, the one on top, always has to be kept straight. Because when you bend it, what happens is that the levered arm decreases and the opening force is less. Both for the left side and for the right side. Very good, close your eyes, enjoy, and now let's finish with the dosing. It's important that when you finish the technique and get up from the sofa, the bed, or the stretcher, you do it carefully, very gently. The spine doesn't like sudden changes in position, and after 20 minutes you might feel some discomfort in your lower back. If you sit up or stand up too quickly, so do it calmly. How should I use this position throughout the day? In the study, it was suggested to do 4 20-minute postures spaced throughout the day, and after 3 days, an increase in the conjunction hole was achieved. a space through which the nerves pass, and therefore a considerable increase within the patient's symptoms. It only took 3 days to considerably increase that discomfort, and the sciatica improved exponentially. An impressive and very recent study that shows us how different techniques can affect the progression of a type of pathology. I hope you've been able to do it at home, that you find the courage and the desire to do it, and that you do it with someone else. Always. Having someone close to you can help, and you can share it with those who need it. Psychiatric issues are a problem that are very common and affect millions of people around the world. Share with your friends, with your family members, with anyone who is in pain, and help them improve their quality of life. If you also have a discopathy or a herniated disc and want to know if you are following the right treatment to get better as quickly as possible, I want to leave you one last video in the upper right corner of the screen where I evaluate all the treatment options available today from best to worst. And I give you the best recommendations so that in addition to this posture, you can include exercises that will help you recover 100%. That's all. I sincerely thank you for staying until the end of the video, and I hope to see you again very, very soon in one of my other videos.